Good afternoon and welcome to Koya Delta's bi-weekly community engagement webinar. My name is Deborah Volleson and I'm the Director of Community Engagement for Koya Delta. I'm joined today, like usual, by Gary Herbst, our CEO of Koya Delta. And in just a minute, we're going to answer the questions that you've pre-submitted, and we're going to give you up-to-date numbers and information on what's happening here at our hospital. So yesterday, I just kind of wanted to share a little bit about yesterday with you, Gary, because we did our second Kids Town Hall, and Carrie Noweski, our Chief Nursing Officer, and Dr. Tamara Ravelin, the Superintendent of the school district, right, they answered questions from kids. And it's awesome. A lot of fun, and I want to give a shout out to Tipper, the rawhide mascot, who joined us and kept it lively, because every time we got a chat, Tipper would run across the background with the cowbell and a little sign that said chat. So it kept it interesting for our elementary kids. And then, of course, we did a high school segment a little later. But the answer to some of the questions were not what kids and parents wanted to hear. Unfortunately, it's kind of left me, I think, a little emotionally fatigued today, because there's so much stress in the unknown. You know, kids want to get back into the classroom, right, parents want the kids back into the classroom, and while we're seeing a light at the end of the tunnel, there are still so many measurements we have to reach and guidelines that we have to follow. But if I've learned anything this year, it's just that there's a desperation for normalcy, whatever that means. I think normal, right, means something different now.
Yeah, and not a new normal.
Yeah.
We miss the old normal,
yeah,
frankly.
Yeah.
Because I was listening to the news yesterday, and it's kind of all over the map in terms of, well, how long do you think we'll be wearing masks? And somebody actually commented, well, I think, you know, around Christmas of 2022, we'll finally be able to get back to, you know, what Christmas was like. And that just kind of hit me, like, but then fortunately I heard somebody right after that is talking about April of 2021.
We want that one.
Yeah,
we
exactly.
want that one.
Exactly.
Yeah, but you know, we've also learned that people are desperate for information too, and that's one of the reasons why we continue to do these webinars, because we don't want our community members to hear about us from Visalia Times Delta or from somebody else. We want the information to come from us. Yep. That's about us. And so, welcome to the program, Gary.
Yeah,
I don't know, that was kind of a downer of a way to start it, but we're
coming. You had me all excited with the Tipper thing. I was kind of disappointed that he's not going to be running behind us. Today? So yeah, it's just us. So yeah, we'll try to make it lively and entertaining as best we can.
Well, we are coming up on March 13th, which is just a few short days away.
Yeah.
And that's the anniversary, not a celebratory anniversary, but that's right, the anniversary of when our command center went live.
Was that on a Friday or a Saturday?
Was it a Friday? It was on a weekend, or it was
Friday.
On a Friday. Thank you, Daniel.
Oh, great.
And
Friday the 13th was the day we stood up the command center. And I remember, I think maybe it was the next day that we stood up the COVID testing site over on Floral and Kaweah, and started actually performing COVID-19 tests. Mm-hmm. So,
and I remember us saying this will be for a few weeks. We'll probably maybe a month or two, and but wow. So we're coming up on a year.
I know, yeah. Not an anniversary we particularly want to celebrate, but definitely one we acknowledge and recognize.
Yeah, absolutely.
Yeah.
Yeah. Okay, well, welcome again, and we're going to get into the numbers. You ready to get rolling? We're ready for good news.
All right, and I do. A lot of good news. And the last thing I want to do is jinx it. I think I told you a couple weeks ago that we in healthcare are very superstitious. Mm-hmm. And we don't like black cats running across our paths or walking under ladders, and don't ever walk into our emergency department and say, wow, it's pretty quiet today, huh? They will run you out and hoist you up on the flagpole with language like that. So, okay, starting at the state level, the state has now performed 47.7 million COVID-19 tests, of which 3.5 million Californians have contracted the virus. So over the 1 year course of the pandemic, that's about 7.3% of everybody that's been tested turns out being positive. On a really positive note, the positivity rate. So the state reported this morning that their 14-day rolling positivity rate has now dropped down to 3.2%. So very excited to see that, and we're really seeing all over the country, similar to California, that the positivity rates, the number of new cases does continue to decline. Sadly, California is on the brink of hitting the 50,000 mark in terms of COVID-related deaths. They reported this morning we're at 49,877 Californians have died of COVID-related causes. That's a bit higher in terms of the percentage of those COVID positive cases that end up dying from it. That's ticked up slightly to 1.44% statewide. And it translates into 127 COVID deaths per 100,000 population. So when you put that into context of like the flu, which is generally, even in a heavy flu season, is in the around 20, maybe even high teens per 100,000 population. So certainly this has been much more deadlier than the normal flu. There are currently 6,764 COVID positive patients that are in a California hospital, of which about 27%, roughly 1,800, somewhere in that neighborhood, are in the ICU. Vaccinations. So the state has now received 10.3 million doses of the vaccine, either Pfizer or Moderna, and they have administered 7.8 million of those 10.3 million doses. So about 75% of them have been administered, which still leaves, 1.5 million roughly that haven't yet been given. And there definitely have been some challenges we'll talk about a little bit later in today's program. But they're also holding back some of those doses for second doses to guarantee that there'll be that second dose for folks that got either the Pfizer or Moderna vaccine. And then lastly, under the governor's blueprint for a safer economy, you recall that once we all moved out, all 5 geographic regions across the state moved out of the stay-at-home order because ICU beds became more available, we went back into the blueprint for a safer economy program. Right now, 47 of California's 58 counties are still in purple Tier 1, widespread infection, the most restrictive. There are 9 counties that have moved into Tier 2, the red tier, and only 2 of the 58 counties are in Tier 3, orange. All of them have some restrictions to them. There is one more tier beyond that, Tier 4, yellow, which is kind of minimal infection spread, where an economy, a society feels like it's kind of returned to that normal access to restaurants and gymnasiums and theaters and churches and everything that comes with that. So that's what we're experiencing today at the state level. Here in Tulare County, we've now performed 426,000 COVID-19 tests, and that's across all the different testing sites, including Koya Deltas. Of those 426,000 Tulare County residents that have been tested, 47,730 of them have tested positive for an overall positivity rate of 11.2%. So statewide 7.3, Tulare County 11.2 over the course of the 1 year pandemic. The county doesn't report a 14-day positivity rate like the state does, but they report a 7-day positivity rate. Again, it's kind of a rolling. And like the state, we have seen our positivity rate continue to come down. and reported today it now stands at 7%, which is awesome. Because that's one of the 3 metrics that you're required to meet in order to advance from Tier 1 to Tier 2. And the threshold is you have to be below 8%. So to be at 7%, we've met that Tier 2 red threshold. Sadly, there have been 739 total Tulare County residents that have died of COVID-related causes. That equates to 1.55% of all positive cases, so a little bit higher than the state. And in terms of how many deaths per 100,000 population, while the state's at 127 deaths per 100,000, we're at 153. So our number of deaths in relationship to the population is actually 20% higher in Tulare County than the rest of the state. And as we've talked earlier, it has a lot to do with the socioeconomic characteristics of our county. It's an impoverished county. We have a lot of congregate living. We don't have the best health factors, health lifestyles. And so a lot more diabetes and obesity and respiratory related chronic conditions that just makes our community and our county more vulnerable to dying from this virus. I've mentioned in the past in terms of the number of deaths related to nursing home residents, 187 or about 26% of the total deaths are nursing home residents. And 76% of all those that have died of COVID have been older than 65 years old. And then lastly, on the vaccine front, Tulare County has received just over 63,000 doses, again, of Pfizer or Moderna, and has now administered 38,000 of those. I looked up a new statistic today that I thought you'd find interesting, is what percentage of our county now, the residents of Tulare County, that would be eligible for a vaccine. So there are 484,000 total residents in Tulare County, but a lot of them are children. Either very young children or school-age children who will not be vaccinated. So I looked at the Tulare County population that, say, is older than 20, because the next cutoff was age 15. But let's say if I just looked at the population of Tulare County that are over 20 years old, which you would think then would be eligible for vaccination, we've only vaccinated 13% of that eligible population. So we still have a very long way to go on increasing the number of vaccines that we administer. So then lastly, coming down to the local level here at Koya Delta, we do continue to be a very busy hospital, but it has kind of subsided a little bit in terms of that intensity. At 7:03 this morning, our acute medical center was 88% full. So we've been in the 90s pretty consistently. So to feel it drop into the high 80s probably doesn't sound like a whole lot, but it does actually start feeling a little bit different here. We also continue to see improvement in our ICU and ICCU intermediate critical care capacity. Of our 41 ICU beds this morning, 13 of them were open, and of our 54 ICCU beds, 10 of them were open. And of our 249 medical surgical beds, 17 of them were open. So out of our 344 adult inpatient beds, we had 40 that were open. We now have been able to return the 23-bed unit on the 6th floor of the Kaweah wing, which was built and designed to be a NICU, a neonatal intensive care unit, that had to be temporarily transformed into an adult surge overflow unit. Because of COVID subsiding and our general census becoming a little bit more manageable, Just the other day, we once again returned it to a NICU. So all of the beds, adult beds, have been taken out. It's all been put back in place, and our neonates have been returned to that unit. So very excited to see that. And then our endoscopy unit, which also became a 10-bed adult overflow unit, that now has been put fully back into endoscopic care, and so no need for that. So some really bright spots we're seeing. The brightest is that as of this morning, we only have, it's still a lot, but we only have 59 COVID positive patients in our hospital right now, which is just phenomenal when you think that a month and a half ago we had 170. So that number has continued to come down. We do have one patient in the ED that is a possible COVID patient, so they probably have results back by now, but not as of this morning. And then of those 59 COVID positive patients that are in the hospital, only 6 of them are in the ICU. Unfortunately, they're all intubated, so they're on a ventilator, but to only have 6 in the ICU, and to be able to care and ideally discharge home the other patients with COVID in taking care of them on a medical surgical unit is really very encouraging. And then lastly, I haven't talked about vents in a long time, but we have 119 ventilators across the entire medical center, and as of today, only 51 are in use. So 6 by our COVID patients, but then the other 45 just by other patients that are needing oxygen breathing support. So, and PPE continuing to build up, and so signs are good. And the last one I'll leave you with, that while we've had, since the beginning of this pandemic, we've had almost 1,200 of our employees and 30 of our providers that have contracted the coronavirus since the beginning of the pandemic. But delighted to report that as of Monday, we only have 32 of our employees that are out on COVID leave that have COVID themselves. None of our providers are out on leave. And we do have 6 other employees that are quarantined at home because they live with somebody that is COVID positive. But we're so excited to have all of our employees and providers back at work. I know they're excited to be back at work. So things are going in the right direction.
Good, very good. So as we transition into a vaccination update, last night for the kids' town hall, it was amazing how many questions we got from kids about the vaccine. You know, if kids are super spreaders, why can't they get the vaccine? And what age do you have to be eligible for the vaccine? Right. So. Yeah, and
gosh, I can't remember off the top of my head. I think at least one, either Pfizer or Moderna, that there's a minimum age requirement. I think it's 12 years old for one of them. I don't know for certain, but I have not really have been hearing of children, you know, even teenagers getting vaccinated. Well, obviously, they're outside of the categories that the state has laid out. So not many 65-year-old teenagers around, huh?
No.
Yeah.
So let's talk about the vaccinations. So are we getting any closer to those being available at our urgent cares and at our rural clinics? I think a couple of weeks ago, we talked about it a little bit, and it was coming, but...
Yeah, so just about a half an hour ago, they removed the gag order that I'd been put under.
So this is breaking news?
This is breaking news, yeah. They didn't want to tell me when it was going to start because they know that, which I think is a positive trait, that I want to tell people. I want to share information, just like your opening remarks here. I want Koya Delta to be your source of information that you can rely on and depend on, and it's going to be the truth. And if we don't know the answer, we will tell you that we don't know the answer rather than making something up. So, but I was given approval by Ryan Gates just a little bit ago to inform you that starting, I think it was yesterday, that we began vaccinating the patients, the established patients of our clinics. So we have 4 rural health clinics, Woodlake, Lindsay, Dinuba, and Exeter. And then we have our family medicine clinic here in Visalia. And so those established patients of one of those clinics, any of them, that meet the governor's eligibility criteria. So they have to be, in that phase 1 or now phase 1B, tier 1, which is essentially, anybody over age 65, or if you're an agricultural worker or a child care worker, if you are an established patient of one of those clinics, then you could be vaccinated. We're doing the vaccinations at our urgent care center on Court Street rather than at the clinics themselves. And Ryan reported that we vaccinated 50 patients yesterday. So that was very positive here, and we'll continue to do that. We actually are reaching out to our patients and starting with those that are at highest risk of hospitalization. So, we obviously know the underlying health conditions of our patient population that we serve, and so we want to make certain that those that are most vulnerable are those that get vaccinated first. I did ask Ryan, I said, I just want to confirm that it is our full intention that Koya Delta will become one of the major vaccinators for Tulare County, and that we will be offering vaccines to the general public. And he absolutely affirmed that, yes, that is the intention. We probably will sign our Blue Shield of California agreement tomorrow. That's kind of the deadline that they've given us. Blue Shield, as I mentioned, has been selected by the state of California to be the third-party administrator to essentially manage the entire statewide vaccination effort. So they are now in charge of determining who gets vaccine and who doesn't. They will do the allocations. The distributions of the vaccine will come directly from the manufacturers, but it will now be Blue Shield that is managing all of the records, tracking to see that vaccine is being used, which is one of the concerns. And it's a concern of the federal government that, they look at the state and they say, well, we know you got 10 million doses and you've only administered 8 million. What happened to the other 2 million? And in some respects, that's why Blue Shield has been brought in, to make certain that there is a continuous, accurate, monitoring and tracking of the vaccine, and to speed up the vaccination. So Koya Delta will be a major vaccinator. Family Healthcare Network is a major vaccinator, and will continue to work with the county to do mass vaccinations. They absolutely are our key partner in this whole vaccination effort. So we'll continue to work with them as well. And as I mentioned earlier, they've now administered 38,000, not just by themselves, but also in concert with Family Healthcare Network and us. But I mean, we're ready to go. And really the only thing that holds us back is just the availability of vaccine. And we know that that's continued to be a problem. Although we should hear maybe as early as tomorrow that Johnson & Johnson receives their emergency use authorization for their single dose vaccine. And they've already promised the federal government 100 million doses of that. And it was suggested to me by Jag Bath and Ryan Gates that, and I'm going to reach out to the California Hospital Association to see if Koya Delta could be one of the first recipients of the Johnson & Johnson vaccine that we would use to vaccinate patients that were discharging from the acute care hospital back to a nursing home or a skilled nursing facility. Because that's been one of the difficulties with the two-shot or two-dose vaccine, is once they leave the hospital being able to control that. But if we can vaccinate them right at the point of discharge and they only need that single dose, then going back to the nursing home, we know that they will have received the vaccine and begin developing, the protection.
Okay, so do you see the volume of vaccines, is that going to be picking up in the next few weeks?
Well, that's what we're being told. Pfizer's located in Michigan, and so, in fact, we were just talking about surgical supplies is at risk right now because normally it's flown to us on an airplane, but now because of the weather, it's coming by truck, taking 3 to 5 days to get here. So. We're hoping that we learn word today that we will receive enough surgical supplies to support us next week. So definitely the weather has had an impact on the distribution of vaccine, but I believe things are starting to clear up, and so we should start to see more vaccine becoming available.
Yeah. So you mentioned nursing home deaths, and then you just mentioned nursing homes with the vaccines, discharging them from our facility. So what are your thoughts on the New York nursing home numbers and the story that's all over about the numbers being incorrect when they reported?
Yeah, you're not trying to bait me into
I'm not
political.
trying to bait you. Nothing political.
Okay.
They just want your opinion.
Yeah, well, first and foremost, I'm incredibly saddened for the families of those that lost a loved one in a New York nursing home. I'm disappointed to learn that information was being withheld. Certainly disappointed. By the decision to return actively positive patients, actively positive with COVID, back to the nursing homes, because we ourselves, that was our first major breakout in Tulare County. I still remember the day. It was a Friday also. It was 3:30 in the afternoon, and we were all in the command center, and we were on the phone with Tulare County, and we were being informed that Redwood Springs was about to evacuate its 170 nursing home residents because they'd had this enormous outbreak of COVID, and they were going to send them all to Koya Delta. So fortunately, and bless our incredible staff here, we said, wait, we'll come to you. And so we had a number of our RNs, LVNs, MAs, other staff that worked overtime, worked extra shifts to go help staff Redwood Springs to keep the nursing home patients there and to keep them healthy, to segregate the infected from the non-infected. And I think, while we certainly had to live through that initial outbreak, which then hit a lot of the nursing homes, across our county, and sadly, I reported that we had 187 of our Tulare County nursing residents that passed away. I'm incredibly proud of Koya Delta for our honesty and transparency. We have, even when it's not good news, we report it, as we're supposed to. So, yeah, it's sad, and I'm not making excuses for them. I don't want to defend them. But certainly New York, was where it first hit.
Right.
And you just think about how much we've learned. Every day we learn something, and we're zigging and zagging, because we've never experienced this before. Could you imagine New York? At least we had the benefit of watching New York, watching Louisiana, New Jersey, other parts of the world. So we had some idea of what we were going to face, and New York didn't. So. I can't imagine, anybody that would consciously, deliberately, send people back knowing that they would.
Well, so what's our process? So if we have a nursing home patient in our facility that is COVID positive, do they stay with us until they have a negative test?
Yes.
Okay, so they stay with us. Okay.
And that's been pretty much from day one. We recognize that. Nursing homes with the congregate living definitely have the greatest risk. And not only congregate living, but they tend to be elderly. They tend to have a lot of underlying comorbidities, and so they absolutely are the most vulnerable for severe hospitalization and death. So we make certain that they're COVID-free before we send them back. And you may also remember that with respect to our skilled nursing facilities, our West Campus and our Court Street, we immediately locked down. I mean, no visitors, staff had to be tested every day in terms of screening and everything because we knew how risky it was. And so we went into lockdown immediately. And fortunately, we had much better, outcomes than New York certainly did.
So if we have a patient that is going to be discharged to a nursing home, not COVID positive, does that nursing home require us to test them even before?
Not today they don't, because actually some nursing homes are taking back COVID positive patients because they have the ability to quarantine them, to segregate them from the rest of the population. So just like us, nursing homes have learned a lot too. They have all the personal protective equipment, the protocols, the disinfection, they're doing that all now. So they actually are taking back some COVID positive patients. I don't know if it's every nursing home that's doing that, but between a combination of us testing them, to make certain that if we do send them back and they have COVID, we can knowingly tell them, yes, this patient has tested positive, but they're ready to return to the nursing home. Do you have the capability of taking them? So.
Yeah. Okay, so we've talked several times about our emergency, how we were at the emergency point for staffing. They sent in relief. We've had state nurses here. We've had the Department of Defense. So now that our employee numbers are significantly lower than they were a month ago, how are we doing staffing-wise?
Significantly better, without a doubt. In fact, Carrie Noeski, our Chief Nursing Officer, just informed us a little while ago that our exemption from this nurse staffing ratios that we're required to follow, like one nurse to 2 patients in the ICU, 1 nurse to 3 patients in the ICCU, 1 nurse to 4 or 5 patients on a medical surgical unit. Pretty much every hospital has been exempt from strict compliance with those nurse staffing ratios throughout this pandemic. But as things started getting better across the state, and as the state was able to procure staff and deploy them to hospitals, just about a week and a half, 2 weeks ago, the state withdrew the blanket exemption that had been given to pretty much all California hospitals. Koya Delta had a specific exemption that we had actually obtained prior to the blanket exemption being put in place because we were being so severely impacted. I think, I reported consistently that Koya Delta, or Tulare County, ranked, 3rd and 4th in terms of number of COVID cases and number of deaths, plus having, more than 1,100 of our staff, many of them RNs and LVNs and CNAs, become infected. It just really decimated our staffing. So that has now changed, and we're okay with our exemption being withdrawn because staffing is so greatly improved, only having 32 employees that are still out on COVID leave. Now that said, we still are making extensive use of traveler, RNs, LVNs, CNAs, a few respiratory therapists. Emma Mosier was just reporting to me, one of our nursing directors, we still have 62 contracted nurses. So they're not employees of Koya Delta, but 62 of them that are still here working in the critical care units, working in the ED. 22 of those 62 are those that we procured through the state, which we're paying an incredibly high premium for. And then we have another 40 that we were able to procure directly on our own with the traveler companies themselves. Now that said, we've also been hiring a lot of RNs and LVNs over this last year. Those that are newly graduated from our local college of the Sequoias, as well as other universities and colleges around the state and around the country. So we've had actually one of the best recruiting seasons in many, many years, so that was very exciting. So the combination of staff coming back, success getting contract nurses, and then the success in recruiting has really greatly improved our staffing situation.
Well, that is great news. So we talked last webinar, and not that I'm going to use your words against you, but I did remember
Did I
this.
say
I
anything
remember
about
this
it?
about lifestyles, because lifestyles is it's a much needed service for a lot of our community members that are on this call and for our employees. So a couple weeks ago, you said you thought Lifestyles was going to be open in a few weeks. And so we're now a couple of weeks away. And
Right.
do you have an update on Lifestyles reopening?
Well, I personally consider the Lifestyle Center to be essential.
Yes,
Yeah,
yes.
and I wish it received that designation, right at the beginning.
Well, because that's a patient. It's a patient gym where
It
we
is.
do therapy and
it's not your typical gym. It's not a Gold's Gym or a 24-hour
Right.
fitness. I mean,
Right.
we are a health and wellness center.
Right.
We actually are a licensed hospital-based health and wellness center. And you're right. We have many of our members are post-hospitalizations, post cardiac surgery or a heart attack, and so it is part of their livelihood, and it's sad that you can go to the grocery store and eat, but you can't go to the gym and
Work it off.
exercise. That is a bad combination, right?
Yeah.
So unfortunately, I think what was called the COVID-15 or the
Yeah,
COVID-20.
yeah,
You taught me that term. Well, it was COVID-15. I've heard
We've
COVID-20.
upped it to COVID-20.
I heard COVID-20 recently, but no, I certainly continue to have my hopes that the Lifestyle Center will be open soon. In fact, I was talking to Jag Bath. Jag oversees the Lifestyle Center in conjunction with Patrick Tazio, who's the director there. I will tell you that they are already working on getting it ready to reopen. We are currently using it, fortunately, much of the Lifestyle Center for children of our healthcare workers, whether they be providers or staff, and we have about 70 children that are enrolled there. We intend to keep them there, but we're going to segregate them, move them into different areas so that we can open up the gymnasium part of the Lifestyle Center. But unfortunately, to open up a gym legally, and that is very frustrating because we know there are many gyms in Tulare County and across the state and probably the country that are illegally operating. And unfortunately, I don't know if that's the right word, but as a public institution, one that respects the law and regulations and tries to be compliant and trustworthy and transparent and all those words, we've been following the governor's order. And if you're in Tier 1 purple, gymnasiums cannot be open. So we have to move into that Tier 2 red. And again, as I reported earlier, one of the measures is the positivity rate. And we're currently at 7%, so that qualifies us for red. The other is you have to have fewer than 7 new daily COVID cases per 100,000 population. And we are currently running higher than that. I think I have that with me here. Sorry to go off camera. We are at 18.4. So 18.4 new daily cases per 100,000 population, and we need to come down to 7 or below. But we're headed in that direction, and that's why I offered my forecast. Maybe I'm going to be off a week or two, but again, it looks like it's headed in that right direction. How quickly it gets there is really up to us, our behaviors as a community, not spreading the virus. And then the other measure is the healthy index, or health equity positivity rate. So just like the overall county positivity rate, you got to be below 8%. Same with the health equity index, and that means the poorest, more vulnerable areas of our county also have to be below 8%, and we're at 9.5. So you have to meet all three criteria, to open. So I think we're going to get there. Patrick thinks we're going to get there, and Jag thinks we're going to get there. But what happens is that once you hit Tier 2 red, you can open your gym to accommodate 25% of your license or legal capacity, which is a lot. I mean, it's a big gym.
Right.
I don't know how many, 55,000 square feet, something like that. So even at 25% occupancy, we'll be able to accommodate quite a bit of our membership. I will tell you, and our intention is, as soon as we hit those numbers, we are opening.
Okay.
Yeah, we're not waiting.
We're turning the sign over to open that instant.
I think we've heard that once you hit the three metrics, that you've got to stay there for like 2 weeks. We're not going to wait 2 weeks. And I'm taking a page right out of the governor's playbook here. So you may recall that when the governor started lifting the stay-at-home orders, that one of the first regions to be lifted was Sacramento. And he lifted it 4 weeks before they actually hit the threshold for it to be released. So you had to have more than 15% occupancy in or availability of your ICU beds. Well, Sacramento region was at 6% of their ICU beds were available, but the governor was predicting that within 4 weeks they would breach that 15%. So he lifted that stay-at-home order immediately. He didn't wait the 4 weeks. So we're going to follow his play, and as soon as we...
I like it, Gary, yeah.
I'm going a little rogue here, I know. You'll come visit me if I get thrown in jail, right?
If you get thrown in jail, yes, we will do our webinar from his cell.
All right, so I'm going to continue down that path. Here's one other one. Even when you hit red Tier 2, gymnasiums are not allowed to open their pools. Oh. And we have a great number of our members that greatly enjoy the heated swimming pool and
the therapeutic,
part of their exercise. So the state, under the governor's blueprint for a safer economy, says it cannot open, even though the lifestyle center will be able to open in Tier 2 red. The pool cannot. However, the CDC says that swimming pools and gymnasiums can be open when the gymnasiums are open. And you know that I have repeatedly said over this last year that Koya Delta religiously follows the CDC guidelines. So while there seems to be a contradiction between the CDC and the state, I'm going to stay true to our CDC following, and so we will be opening the pool at the same time we open the gym. Well,
that is really good news, and I like the new Rogue Gary. We like that. We're going all in,
okay.
And
keep it a secret.
Yeah. So before we shut down Lifestyles, we were practicing social distancing. We were masking. We
and let me add. I want to add something to that. We will absolutely continue, because even when you get to open, you still have to socially distance, so the equipment has to be moved apart and stuff. You'll see incredible sanitation that will be occurring. And we will require mask wearing at all times, including when you're working out. So we didn't require that when you were, running on the treadmill or you're on the gauntlet or whatever. You didn't have to wear your mask, only when you had got off and you were moving around. But we are going to require mask wearing, probably until we get to a vaccination stage that gives us greater comfort.
Okay, wonderful. So since we're talking about cool updates like that, give us an update on the ED and the Tulare Clinic.
Yeah.
They're both in the right direction.
Oh, yeah,
moving in the right direction.
Absolutely. Although I will confess a little setback, again, I just learned of this morning. So earlier this week, we had our board meeting on Monday, and we actually took our board and myself and a few of our exec team members took a tour through the ED expansion area, and I will tell you, it is beautiful. It is modern, lots of space, beautiful rooms. It's going to be just a wonderful, I shouldn't say experience, because I hope none of you have to experience the emergency department. But if you do, you will be in a real state-of-the-art modern facility with great caregivers there to take care of you. So we're coming down the home stretch. We had actually or had planned that next Thursday, March 4th, we were going to receive our final OSHPD inspection. And if all went well, the next day we would receive our certificate of occupancy, and then we would immediately begin installing computers and monitors, stocking with all the supplies and medications, just getting it all spick and span, and then would look for the California Department of Public Health to come on site and do our on-site survey, and then we would probably be ready to start seeing patients maybe mid to late April, very early May. Unfortunately, we were doing some of our own inspection yesterday, and we're having great difficulty balancing the air handlers and the pressures within the expanded ED area. And so we now have to order new replacement fans to accomplish that. And so it looks like that March 4th final OSHPD expansion or inspection is now going to slip to March 27th. So pushing us back by about
weeks,
3
yeah,
weeks. So that was disappointing to hear this morning, but I don't know if we can stomp on the gas pedal a little bit harder and still stay with the the original deadline, but it may slip a bit. But it's going to be worth the wait, I will tell you.
Right.
And then with respect to Tulare, we did receive our certificate of occupancy, and like the ED, they are currently installing computers and monitors and stocking and staffing and getting it ready. It also is a beautiful, almost 11,000 square foot clinic. So Mark Mertz and I are actually going to have been invited to attend a city council meeting, the Tulare City Council meeting in March, where we'll get to maybe show some pictures and express our appreciation to the community of Tulare that has been incredibly welcoming and really looking forward to us being there.
Fabulous. So I'm going to throw in one here that came right before the meeting started. And this is going to go back up to the cases per 100,000. So the question was, who determines that more than 7 cases per 100,000 is widespread? Who makes that determination? I
don't know. Well, yeah, I don't know. The governor certainly has, I guess, the final say. All of these things, the stay at home, the original shelter at home, the blueprint for a safer economy, all of those have been put forth by the governor through executive order. So technically, he is the one making the decision and enacting it.
So he can just choose that metric?
Well, I don't. Probably, but I would imagine that he has a whole COVID team made up of scientists and epidemiologists. Dr. Mark Galley, who I think heads up the California Department of Public Health, or maybe he's the Secretary of Health and Human Services. He's been a major spokesperson for the governor throughout this pandemic. But I would imagine, that they are, setting the criteria. There's some logic to it, obviously, that the greater, the outbreak, the higher the positivity rate, the higher number of daily new cases, it means you have a widespread outbreak of COVID. And so he's trying to shut it down, trying to flatten that curve and drive down infections. And as you get a little bit better, then you get to start opening up a little more. I've disagreed with his position on not allowing outdoor dining because you have great air circulation. People are all distanced. You're generally sitting within people within your social bubble, you know, and all the waiters and waitresses are all masked up, and I've watched them disinfect after. And I think there's very little evidence to show that people have been contracting the virus through outdoor dining. Now, was that his decision alone? I don't know.
Yeah.
I have not, although I have to say, I mean, I haven't looked at other states. I haven't gone on to, you know, their websites, like the California COVID website, to see if they have a similar tiered system, and they might, and perhaps some of these recommendations are coming from the CDC, but I don't. I mean, the bottom line answer,
yeah.
I don't know.
So this question came from an adult, but it was asked in several different ways during the kids' town hall by children. You know, if COVID is it's across the nation, you know, why is California the only one shut down for in-person schools?
Yeah.
And, you know, our kids feel like they're behind now other states because of, you know, we're the only ones not allowing. So they were wanting to know as well, who makes the rules? You know,
Yeah.
who gets to say no in-person classes when one state away?
I would say
they're
the
all-
governor
the
does.
Governor,
The
yeah.
governor does ultimately.
Okay, so Gary, if you could, as we come up on our year anniversary, March 13th, if you could go back to the beginning of this pandemic and do anything differently at Koya Delta, what would you do?
Okay, so when you posed this question
Yeah.
to me, I was assuming that I could go back to the beginning with all the knowledge and experience that I've gained over the year.
Yeah.
I mean, I wouldn't go back starting over and not knowing anything.
Right,
So,
right. So
if I knew
you
back
know,
then
yes.
what I know now, there'd be a lot of things I'd probably do differently. The first one is I would immediately go on a crusade to acquire personal protective equipment. I would buy as many N95 and surgical masks and shields and gowns and gloves and perhaps HEPA filters and ventilators, and I would immediately set to work on converting our positive pressure rooms into negative pressure rooms. Things that we had to do, you know, on the fly as we went. The absence, the scarcity of PPE was probably the most difficult thing for us. So I would definitely have done that. I probably wouldn't have shut down surgery because, you know, we were told in March, you need to close down. You need to stop doing elective surgeries and brace yourselves for the surge that is about to arrive, a surge that never did come. We did not experience our surge until late July. So our hospital sat empty pretty much in March and April. We finally started elective surgeries back on May 18th, but we shut down for 2 months in April, or in March and April and half of May when we didn't need to. I didn't know it at the time, but I know it now. And so I would have waited. I would have waited until the surge arrived and then shut down at that point. And I probably would have instituted more restrictive compliance with PPE. I think we maybe ran, I won't say ran loose with it, but we didn't understand, you know, the severity of the transmissibility and everything, and you know, just wearing surgical masks initially and not N95 masks. I mean, we finally, you know, it was months into the pandemic when we started requiring every single employee had to wear a mask. Before, it was just caregivers, frontline healthcare workers. But the rest of us were just as vulnerable, you know, contracting it at home, contracting it with friends, and then we would come to work and not wear masks, and were we transmitting the virus to other employees? Remember when we first started wearing masks, they said, it's not to protect you, it's to protect you from giving the virus to somebody else. That's why we started wearing masks. Well, why didn't we start that on day one? You know, we waited for several months, but we didn't know.
Yeah.
So that would have been something I would have done different. I I can't think that I could have implored the public more in terms of following, the safe practices and everything. They probably got sick of me, telling them, asking them to do that. But I would have had a different perspective about just how dangerous it was. If I knew that we were going to have almost 800 Tulare County residents die of the virus over the course of the pandemic, and talk about the surge that we experienced over the winter, the 170 COVID positive patients, and our county was seeing close to 20 deaths per day. If I'd known that early on in the pandemic, and I could have shared that information, that perspective with people, would it have made a difference? I would have been able to tell them that when you follow these behaviors, they work, because that's what they did over Christmas and New Year's. Mm-hmm. They didn't do it over Thanksgiving, and we got slammed. But I think they saw that, just how, again, deadly and transmissible it was when they saw what happened after Thanksgiving. And again, we implored them, please resist the large gatherings for over Christmas and New Year's. Mm-hmm. And they must have done that, because we did not experience any real uptick in COVID, the 3 to 4 weeks after those holidays. So if I'd known that, mm-hmm. I could have told them, your mm-hmm. behaviors work. Let me describe the future for you, So,
yeah. Well, you're our first CEO to go through a pandemic.
I am, yeah. I hope I'm the last one. I hope I'm the last one. I don't wish that on my successor. Yeah. But even, again, I could probably think of more that I could have done different. But at the same time, I could not be more proud of our organization, our leaders, our staff, our physicians, who, had to experience this. You hear the term, building the airplane while you're flying it. Mm-hmm. I mean, that's literally what we were doing, what it mm-hmm. felt like. And we were, it was amazing, the proactive, right actions and decisions that we made. Koya Delta was on the map. I mean, California hospitals were talking about Koya Delta mm-hmm. Repeatedly, and what we were doing and what we had done. And, so that only happened because of the dedication and the commitment and the talent and creativity and of again, just the whole Koya Delta family, and every single person played a critically important role in that. And even the folks that that were telecommuting at home, that we mm-hmm. had to send home for their own safety, mm-hmm. They kept working, they kept right. contributing. They're a major part of the operations mm-hmm. of the organization, and through their work, they allowed us to get our work done here. And right. So every single member of the Koya Delta family should feel incredibly proud of the work that they did.
Yeah, well, thank you, Gary, and thank you for being the great leader of this organization. And so I'm going to thank everybody for being on, and I'm going to let you close. So
yeah, how much time? Oh,
we've
2 minutes.
2 minutes.
All right. Well, unfortunately, my closure is becoming pretty repetitive, and it's just once again thanking all of you for tuning in for all of our sessions. I'm grateful to all of you for continuing to show such interest and support in Koya Delta, and for your excellent questions that again have played an important part. They've been influential. They've guided a number of our decisions and helped us with our communication out to our community. And so I just want to say thank you to all of you, and hope you continue to stay tuned. We plan on doing this into the foreseeable future, and continue to welcome your great questions, and hopefully we'll begin sprinkling a couple non-COVID questions. Maybe we'll have to seed it ourselves, but yeah, again, I hope you all have a wonderful weekend and enjoy this beautiful spring weather that it feels like.
And I just got a text from somebody that's viewing saying, hooray for Gary going rogue. Thank you all.
All right, thank you.